Today's April 21st, and we're gonna do our in-service on infection control. So we currently have an outbreak with COVID. Anytime you have a resident that's positive for COVID, the California Department of Health considers that as an outbreak. And so when you have an outbreak, you also have different testing. Anybody who's been near or close to an individual who's positive with COVID, start showing symptoms, we have to test them. Okay, we even have a family member, and I was like, that's not happy because we test her. We end up picking up a resident who's positive, and I had to remind them that this is not Secret's policy. This is a state and federal guidelines on testing. Okay, so just go ahead and go over some of these things in terms of communicable diseases and how diseases spread. What do we do to prevent spread, and what do we do to kind of like, once you have an outbreak, how do we control it, okay? So transmission-based precaution, there's 4 basic transmission-based precaution, how things are spread. There's the airborne, okay? Any viruses or bacteria that's small enough that goes basically airborne, that goes past the 6 feet and further is considered an airborne, right? So for example, if you have tuberculosis and you sneezed out, right? You're positive for TB and you're sneezing and coughing, that can get into the vent and can infect the whole facility, right? That's airborne. And in order to mitigate or slow down the spread, a lot of hospitals, not skilled nursing, some skilled nursing might have it, but very few. We don't have it. Most of your skilled nursing in San Diego don't have it, but they're gonna have a negative pressure room, right? And that means that it's usually like a vacuum that vacuums all the air out and pushes it outside, right? So anything that's contaminated in the air, if there's viruses in the air, bacteria in the air that can get you sick, it gets filtered outside, so you're breathing in clean air, right? Or they might use like a HEPA filter that filters all the air and basically leaves air without any kind of viral load, right? So also we use like N95 in those situations, really tight mask and fitting type of N95 respirators, so to prevent viruses from coming in. So one of the ways to really stop the spread of infection when it comes to like airborne is a tight fitting mask, okay? And some people might argue, hey, you know what, we have this mask, it doesn't really work. A lot of times it's not working because of the fact that it's not tight enough around your head, right? You might have hair, you might have facial hair. Sometimes you get fitted into a respirator, and then either if you lose weight or gain weight, that can change your respirator as well, right? That could put you at high risk for infection. There's also droplet, right? Influenza is considered a droplet. That means that you can spread the disease if you're 6 feet or closer to the resident, right? So if you're coughing and sneezing, a lot of times these viral particles is encapsulated in like spit or some kind of fluid that's coming out of your mouth, and so it'll only travel 6 feet for the most part. Most of them will fall even closer. So this is known as droplet precaution, right? And most of your viruses and bacteria that we deal with here, that we can manage in skilled nursing, is going to be droplet, right? Influenza is one of them. Coronavirus is one of those weird things. It's considered both like airborne and droplet, but for the most part, I think COVID is mostly like droplet. So if you look at the policies on the infection control process, they want you to wear N95 when you're dealing with coronavirus. You also have contact precaution, right?
I was just gonna say.
Right? Contact precaution when you're touching stuff, right? Like you're able to transfer diseases, bacteria and viruses from touching, right? For example, MRSA. If you have a patient that has MRSA and you have it on your hand, you can transfer it to another resident or a coworker. Okay, that's contact precaution. In those situations, you typically wear gloves and gowns to prevent contamination. Okay, and then universal precaution, guys, is just you're treating everybody as if they're infected, right? Even if, like, for example, you have a patient that comes in and they have a fever and they're coughing and sneezing, right? You want to treat that person as if they got some form of respiratory infection, and so you'd wear masks, you'd wear you'd wear a face shield, you wear a gown and gloves. That's really what universal precaution is, where you're just treating everybody with some form of that they're infected, then you're gowning up, you're gloving up, protecting yourself. Okay. PPE. PPE is considered the equipment that we use to protect ourselves from getting infected, right? Gowns, masks, goggles, gloves. Sometimes we even have these like cover for our shoes, right? We have covers for our hair. And there's different ways to put them on. There's when you're putting on PPE, how would you put them on, and what's the difference between putting them on and taking them off? So when you're putting on your PPE, for example, right? There's really no specific. There is a specific way to put on your PPE when you're going into a resident's room, right? And they're infected, right? And this is primarily for the ease of it, okay? And it's not in any way, oh, you're gonna infect yourself, but typically you would do is you put your gown on first, right? You put your gown on first, and then you put your mask, and then your goggles, and then your gloves, right? And so, but that's really just for, you know, for the purpose of like putting them on comfortably. Like you wouldn't put on your gloves first and then try to put on your gowns. It's just a little bit more difficult, right? Because you already got your gloves and it's harder to kind of tie these gowns. So always put your gowns in. If you can't remember like how to put this on, just remember that, you know, what's the easiest way to put this on? Like I'm not gonna put my gloves on and put my gown on, you know what I mean?
I remember to do my gloves last because of the fact that a lot of the gowns have those thumb guards.
Yeah.
They come over the thumb, and then you put your gloves over that.
Yeah.
So there's nothing,
Right.
it doesn't pull apart.
Yeah.
That was those
And
gloves
then-
are last.
Yeah, that's right. Yeah, and you can't. And the other way is the goggles and the mask. Like you can't put goggles first, then the mask, and the mask, then the goggles. Right? So it's really just common sense. Now removing it is where this is how you get infected. If you did everything else correctly, and this patient has some kind of infection, and then you're removing it incorrectly, yeah, you're gonna get infected. Okay. Because what's the dirt? You're gonna remove the dirtiest part first, the dirtiest PPE first, which is the gloves, right? Yeah. You're gonna remove the gloves first, and then if you feel that hey, your PPE is full of these viruses and bacteria, would you take that off outside of the room, out in the hallway, or would you try to keep it in the room, right? Remove
Put it in the room.
Yeah. You don't want to be stepping out and this stuff unless it's like you have a droplet precaution and then it's your mask, right? It's okay. Your mask you can remove it outside. You're supposed to remove it outside anyway, right? But if you have specifically our rooms right here are built for like an isolation precaution because you have that nice little like what do you call it, curtains, right? And there's like a little area right there, And if it's 6 feet and further, like if it's droplet, you can literally like supposedly be safe from it by just being 6 feet away from that resident anyway. But the best practice is if you're removing your PPE and somebody's on droplet, let's just say COVID, right? You remove your gloves first, right? Because that's the dirtiest part. You want to try to remove your gowns in that vicinity as well. Don't step out because you get people infected outside as well, right? And how do you remove your gowns? What are you touching in your gowns? Which one? What are you touching? What can you?
Inside.
From the inside? Okay, because you got clean hands now, right? You got clean hands. You took your gloves off. You can do hand sanitizer if you want, but you don't need to. You can remove it from the inside or pull the strings because you're not touching the strings, right? That should be clean. You can pull the strings and then you can remove it from the inside, right? And then roll it up and then throw it away. But never touch the outside part of your gown. And just because it's already, and you could accidentally do it, you just gotta do hand hygiene right afterwards. Okay, before you start removing other stuff in your body, right?
And then you do the goggles and the mask at the end.
And then you do the goggles or the shield. You can just remove it, right? And then you can step outside and remove your mask or N95 outside. Okay. So and then what are you touching when you're removing your goggles or your mask or whatever? Which one are you like supposed to be touching and removing? What part of the mask or goggles? Right?
The strip.
The strap.
The straps. Yeah.
Elastic strap.
Because those are clean. When you're providing care for the resident, you're not touching those. Those are the only things you can touch, right? Splashing and coughing and droplet precaution, all that stuff could be in the face shield, right? So you don't want to be touching that or any of that. Okay, so remember putting on your PPE, right? And then removing it. The N95, the N95 is anything that it is basically a respirator that filters 95% of the air particulate, right? So if you have somebody who's on COVID, um, it's recommended that you wear N95, even though it's not airborne, right? But it's just recommended you wear N95. Okay. Also, there's a 15-minute time frame, right? That we consider that you're a higher risk of infection if you're staying in that room for 15 minutes or longer, right? So you stay in that room and then you try to minimize your exposure to a infected resident. Do what you can, then step out, after 15 minutes, and then you can provide care later on as well, right? So that's the time frame that we're looking at in terms of decreasing your likelihood of getting infected. But if you have the right PPE on, I feel like that you're safe to stay there longer than 15 minutes anyway. It's just that's the time frame that they have now in terms of when you stay longer, 15 minutes, apparently you're more likely to get an infection because the viral load is built up, right? Whether it's going into the pocket spaces that's open in your mask or N95. And how many people do you think out there are walking around and they're going into an infected room and it's not tight enough, right? It's uncomfortable, and we're like removing this mask and making it as comfortable as possible. It's comfortable, but you're putting yourself at risk, okay? And you've seen people with like these lines and cuts in their faces, and unfortunately, that's the safest way, to go when you're dealing with an infected person. Is that this mask has to be fitted around your face really tight. Otherwise, it's not doing anything for you. Okay. But N95 filters 95% of the air particulate. Okay. And then it has to be approved by the NIOSH. So if you have an N95 that's saying something that's not approved, it's not from America, it's from China or whatever, and it's really loose on you and you're going to a room that's infected, you might get infected, okay? Because it has to be approved by this entity, NIOSH, okay? And on your N95, I don't know if you have one, it'll say on there, it'll say it's approved by NIOSH, okay? Surgical mask is a way to kind of mitigate infection. I mean, it's good to use when there's like influenza, when there's a lot of coughing. You don't want to use the blue mask, the surgical mask, if somebody has like TB or something like that, right? It's really, first and foremost, it's really loose, right? And it's not, and it's 3-ply, so it's not going to filter anything significant, right? You're likely to pick up viruses on this. Okay? Use of a mask. Let's see what else. There's some viruses. We're just talking about viruses here. Okay. And then let's talk about hand hygiene. How to wash your hands properly. Okay. Remember COVID when maybe now, people, when there's an outbreak, a significant outbreak, let's just say in a big community, and there's a water source somewhere, they're gonna the county will test the water to see if there's COVID in the water. So a lot of times they'll test the drinking source, and they've found many times where the actual drinking source has COVID, and it'll affect the whole building. Yeah. So, but during COVID, it's really hard to pick up COVID and eat it and get infected through that because your gut will kill most of these viruses, and the way to get infected with COVID mostly is salivary gland that goes into the respiratory or in your eyes, through your nose, through your mouth. That's the number one way to really get infected with an infection. But it's really weird because during COVID they did all these studies. Can you get infected if there's COVID in the food? And there was very little study that said you could. There was a lot of studies that said, people ate food, regardless, people were coughing or sneezing on it, and they still didn't get infected, But you could get infected by walking into a room and you're within 6 feet away from this resident because you're inhaling it. You're not, that's why it's so important when somebody's infected in terms of resident because they're not doing a mask. All these viral particles in the air, and the more concentrated, the more people that are infected in one room, the more viral particles floating in the air. It's more concentrated. So right, that's getting in your eye, that's getting in your nose, that's getting in your lungs. That's how you get sick. So while I'm gonna talk about like washing your hands, it's so important to like not get sick. The number one way to get sick with COVID and anything respiratory is what? Is through the nose, mouth, and your eyes and all that stuff. And the more viral load that you have, the greater risk you are you're gonna get sick. But contact precaution is really important too, right? If you're touching something, it's in your hand, you can get people infected. So we can talk about contact in that sense, right? But I still believe that COVID-19, you can't pick it up by just eating it. You know what I mean? Like you have a viral particle and there's some COVID that dropped on there and you ate it. It's not likely. They had so many studies on that because the primary source of getting infected with COVID-19 is through the nose. But we still talk about it. When it comes to COVID-19 and infection and spreading it, we talk about hand hygiene all the time, right? Because this is good practice. But you can pick up everything else in between, right? MRSA and hepatitis, and then transfer it. So washing hands is really important. If you're dealing with anything mucosal membrane, you gotta wash your hands soap and water, right? Alcohol, you can use the alcohol so long as your hands not visibly dirty, okay? And then the only time we use bleach is when we're dealing with C. diff, right? When you C. diff, but bleach is good. It's just very toxic, you know. And we break out bleach when we're dealing with C. diff. Okay, everything else can be dealt with these alcohol, and we have buckets of these alcohol wipes that tells you on there like what it will kill, right? Like it's got kill time, but it also will list the virus and bacteria that it will kill. Okay, so it's really important to kind of know what you're dealing with and whether it's virus, whether it's contact, whether it's droplet, whether it's airborne, because then you can prepare yourself, right? So when somebody comes in and they're saying, hey, they're on contact precaution, right? It's great that like we know they're on contact, but I really want to know like what kind of bug we're dealing with. You know what I mean? Because it could be CRE, it could be vancomycin resistant, it could be MRSA, and then each one of those bacteria is more significant than the other. You know, so but you should probably treat every single one of those multi-drug resistant organism, as if like you shouldn't say, oh, this is not as bad as this right here. They're all pretty significant, when it comes to multi-drug resistant organism, and which means that these viruses can be spread contact, hand to hand, or hand to mouth. It can be spread, and if you get sick, you're gonna need treatment, like a significant treatment, really high powered type of antibiotics. Okay. If somebody was in isolation, what would you first ask them, Don? What's important to you as a CNA? Like, oh, Don, I'm a nurse, right? I just come in, I'm busy. Like, Don, room 32 is in isolation. Make sure you do.
I want to know why.
What's the most important? If you could just ask them one question, what's the most important thing you can ask them?
What is the precaution? I mean, what's the contact?
Yeah, that's right. Yeah, you want to know what
Airborne.
How is it spread, right? Is it airborne? Is it contact? Is it a droplet, right? Because then that'll like again, we will likely not deal. Besides coronavirus, we won't be dealing with airborne yet. Okay, but coronavirus. If you know it's coronavirus, you wear N95, you wear gowns, you wear gloves, right? There's a lot of spitting and coughing. You want to wear some shields as well, right? But if somebody's on isolation, we get the MRSA side, it's contact, right? Do you really need a face shield if it's in the womb, right? You don't really need it, right? So that's why it's really important, like, to kind of like, okay, I see that he's in isolation, but what are we dealing with? You know, because sometimes they're so busy, they're just like, oh, they're in isolation. It's up to you to figure it out what the hell you're gonna put on. You know what I mean? Like, because some, you know, it's you don't want to get yourself infected. You don't want to take it home by putting in the wrong thing. You know, it could be MRSA, and then you're like, yeah, it's MRSA. It's yeah, we'll just go put whatever, and you're thinking, okay, it's MRSA, it's in the wound. It's actually MRSA respiratory. So now you have, instead of doing contact MRSA, you know, gloves and gowns, you know, it's MRSA respiratory. Now you're dealing with, you know, droplet. Now you gotta put shields on and mask on, right? So never be afraid to like ask more questions, right? Because it's you that's gonna get infected. So that nurse probably knows, yeah, it's in contact. It's whether it's contact, respiratory, droplet, airborne, and they don't have time to tell you. But you're not asking questions, and you're gonna be the one getting infected. You know what I mean? So if you can't get the questions that you're looking for, go to the resource nurse.
Can we look it up on the med books?
You can look at, you can go in that, yeah, you absolutely. You can go in that room, right, and have a folder, and it'll tell you history of that resident, right? But you know, you have resource nurse, you have me in here, you have other people that you can ask questions that if you're not getting the answers that you need. Okay, it's really important. You kind of like you need to know what you're dealing with in terms of infection. Okay, just because if you have an outbreak with COVID, don't think, oh yeah, if there's a yellow card, it's gonna be COVID. It could be it could be something different that they're being isolated. We have all kinds of like nasty walking around in here. You know, it's not just COVID, right? So make sure you're 100% sure.
It's an E-tray dish.
Yeah, make sure you're 100% sure you know what you're dealing with. You shouldn't be afraid of dealing with isolation. You should. What you should be is you should be empowered. You should be. You should have a lot of knowledge, because unless you've planned to not be in nursing or in the medical field, you should go out there and ask questions and say, okay. You shouldn't look at it as like this is the last time I'm going to deal with this infection, because if you go from here to Seacrest to the hospital to everywhere else, if you're still in the medical field, you're going to be dealing with this all the time. So you might as well get to know it, right, and be comfortable with it. And so when you run into that situation, you already know. You don't have to be like, oh God, I don't even know what I'm dealing with. I'm so scared to deal with this virus or this bacteria or whatever. You know, get the right information, because it's just a skill that you're gonna need, because you're gonna be dealing with it again, I guarantee you. Okay, COVID. There's gonna be a different strain in the future, and it's gonna be even more significant. So we gotta have the right approach. Okay, let's go over the questions real quick here, guys. Don, you want to read the first question? What's the first question?
Communicable diseases are transmitted only through blood and other body fluids.
Is that true?
False.
It's false. Okay, Aaron, what's question number 2?
A protective isolation gown may be worn more than once.
Can you wear it more than once?
True.
You can wear it more than once?
I was just if it's a material one, that's the catch-22.
Gowns and stuff like that, we can't do that anymore, guys. If we're short of PPE, right? The gowns and stuff, when you're going in, you gotta get rid of it. If surveyor comes in, and then before, yes, because we had
The material gowns,
yeah,
those ones that we,
the cloth.
yeah,
Oh, we don't use. We're still using that?
Yeah, there's still some. I used some
Yeah.
today with
yeah,
21.
we still have some.
Really?
That's why I was like, do you see what I'm saying?
Yeah. No, I got
Say
it.
times 3, as long as it's that shift,
Okay.
and you're the only one
I
that's
think
wearing
we can
it.
get away with it with hair, but like, we shouldn't be.
Technically, yeah.
We should not be using those. Okay, I'm gonna talk to Sam.
So false.
But think about it, guys. Infection control process, right? We don't have shortages of PPE. The only reason why we did all that is because like it was a pandemic. Not just here at Seacrest, not just here in California, not just here in America, but it was worldwide, and we were out of PPE. The only time we could do it.
Yeah, when COVID first
Yeah.
started.
Yeah. We're no longer, we don't have a
We used to
pandemic.
have
We don't have a pandemic. These things are like 10 cents each. So, we should not be doing that. I mean, like if surveyor comes in and we're still doing that, we're gonna be put in the binder.
So false.
I guarantee it. Yeah, we're probably doing it now, but I don't understand. No, I'll talk to him. But If you get asked questions, just know that you can't use gown over and over again. Okay, not ever, not whatever, okay? We have a lot of gowns, and it would be, Seacrest would be the one in trouble, not you guys. If you say, hey, you know what, it's a hair, we're using it all the time, yeah, well, we should have gotten rid of it. Okay, alright, what's 3? If protective gloves are worn, you still need to wash your hands before and after treatment. Is that true?
True.
Yeah, you have to wash your hands before and after.
Wash your hands,
Okay,
wash
that's
your
just
hands, wash
standard precautions. And also, there could be holes in the gloves, and if you're dealing anything with mucosal membranes, right, you have to wash your hands. Okay, it is best to step into the hall when taking off a contaminated protective gown.
False.
When you're contaminating everybody else in the hallway. If a resident has a respiratory infection and is in isolation, you only need to wear a protective gown and gloves. False. Okay. A resident may be put in isolation if he or she has an active contagious infection.
True.
May be put in isolation if he has an active contagious infection.
It's active. It's contagious.
When can we put somebody on isolation? It's not known as isolation. What is it called? Quarantine. That's when you suspect somebody with an
This says
infection.
isolation, John.
Yes.
Okay, this is true then. So if you have
like,
active
don't
contagious.
Make us guess.
No, there is there's
There's
a reason
quarantine
why
and
this is false.
isolation.
I'm trying to figure out what it is. A resident may be put in isolation if she has an active contagious infection. Okay, alright, let's just put
True.
true in there. Well, no, I can't think of anything right now. Alright, list 4 tiers of precaution.
Airborne, droplet, contact, and
Oh, I
universal.
thought we were putting the
Very good.
airborne.
What's the at the bottom, the one the most significant? Airborne, right? It doesn't have to be in order, right? But it's airborne, droplet, contact, and then the universal or standard precaution. It's called standard. Okay, the best way to prevent the spread of infection is to wear protective gloves. What's the best way? That's right. All right, list the proper way of donning. We talked about this already.
Gown, mask,
Gown, mask, goggles, and
gloves.
gloves.
Yeah.
The dirtiest.
Okay, good. Everybody got that? All right, and then how about removing it after?
Gloves, gown, mask, or
Goggles,
gloves.
mask.
Yeah, goggles, mask.
Gun, shields, and masks. Okay, perfect. Any questions on anything?
No.
You feel comfortable going in the COVID room and having a COVID party?
2 days, John.
What are you bringing?
Drinking tequila, sanitize in that way.
What's the last one? Gloves, now we're goggles. Okay, that's very good.
Okay, perfect.